Hi, Dr. Pelto here. I want to go over a little bit about how orthotics can be used to help your foot pain. We have many patients in the office, and they struggle on a daily basis with different types of foot conditions. Some of the most common conditions are plantar fasciitis, flat feet, pain to the front of the foot, neuromas, hammer toes, and tendon issues. And many of these conditions, they respond well to custom orthotics. But let me explain a little bit about the rationale behind an orthotic and really what is an orthotic. An orthotic is an insert that goes in your shoe, but it's not just an insert. It's not just like an over-the-counter device. What I find many people get confused that they try an over-the-counter device. They might get one from Dr. Scholl's, one that has a lot of cushion in it, and they don't find it comfortable, and they say, well, orthotics aren't going to do anything. On the other end of the spectrum, they could try something that's very rigid in the arch, and it hurts their foot. It might cause blistering, and it's uncomfortable. When you think about those that are making these over-the-counter devices, they make them for the bell curve. They make them for the majority of people that will get a little bit of relief, but it won't really resolve their issue. That's the importance of having a custom orthotic. I find a custom orthotic is much more beneficial because it contours perfectly to your arch. And the most important aspect of a custom orthotic is that it can stabilize your heel. So that the heel, a deep heel in orthotic is very important. So that's the first thing you want to look at is how deep the heel is. The second thing you want to look at is the arch. Can you push that arch down just with your thumb? Can you use your thumb just to push down on that arch? If you can, then it's not really doing anything. You want something that's going to be more rigid for you if you're having a bony problem, such as something caused by plantar fasciitis, flat foot arthritis, things like that. I find that orthotics are only part of the treatment process. With most of the conditions that we treat in the office, we want to treat three different things. We want to reduce the inflammation, and I find that is done using icing, anti-inflammatories, contrast baths, cortisone injections, and then shockwave therapy. The second thing you want to do is reduce any of the tightness in the tissue above the area of injury or around the area of injury. And that can be done with foam rolling, physical therapy, different types of strengthening exercises. And the last component is doing the orthotics. Orthotics are used as part of the treatment. It's not usually the only treatment. So for example, I had a patient that came in just today. She came in with 3 sets of over-the-counter orthotics. She called them kind of custom, but they weren't. She got those at the Good Feet store, and they had her get these 3 sets of inserts. When they didn't do anything for the inflammation, they didn't do anything for the tightness. All they did was give her something, and it didn't have a deep heel cup. And because of that, her symptoms were all the same. It's hard to tell someone that she just wasted her $1,800 on that, whereas a good orthotic is probably going to cost you about a third of that price if you go to another place. So just be wary. I think orthotics are beneficial. They're not beneficial for everyone. Not everyone is a good candidate for them, but many people are. You should really see a podiatrist for evaluation. And if you want to learn more, I'm going to put some other resources underneath this video about orthotics, and I'd encourage you to make a visit to the office if you're in the area of Massachusetts.